Good evening, friends. Here is your hospital management update as of today, 26th August 2026. Indian Hospital Business Management Update, 2026. Introduction. Welcome back to the channel. If you are managing a healthcare facility in India today, you know the ground is shifting beneath our feet. In 2026, running a profitable hospital isn't just about clinical excellence anymore. It is about navigating a hyper-connected, tightly regulated ecosystem. Margins are shrinking under inflation. Patient expectations are at an all-time high due to consumer tech. Meanwhile, compliance standards have become absolutely non-negotiable. If your operational strategies are still stuck in 2024, your facility is bleeding revenue. Today, we break down the exact operational shifts you must implement right now to protect your bottom line, retain your best talent, and deliver seamless patient care. Let's dive in. Module 1, the ABDM ecosystem and digital health. Let's start with the biggest regulatory driver of the year, the Ayushman Bharat Digital Mission. ABDM is no longer a pilot project, it is the national standard. Why Aadhaar IDs matter now? Instant onboarding, integrating Aadhaar or Ayushman Bharat Health Account IDs into your front desk workflow is mandatory for rapid patient entry. Zero duplicate records, centralized IDs eliminate data entry errors and missing patient histories. Unified Health Interface, the UHI allows cross-consultations across different hospital networks seamlessly. Actionable upgrades for managers. Audit your EMR, ensure your electronic medical records software is 100% ABDM compliant. It must support automated data pushing to the National Health Cloud. Train your front desk. Your reception staff should actively nudge patients to link their Aadhaar IDs during registration. This single step slashes registration time by up to 40%. Accelerate insurance claims. Real-time data sharing via the digital stack means insurance TPAs can verify clinical data instantly. This eliminates the endless back-and-forth emails during patient discharge. Module 2, Cost Control, Inflation and Supply Chain. Just-in-time versus bulk buying. Our second big pillar is cost control. Inflation in 2026 has hit medical consumables, reagents, and biomedical equipment maintenance incredibly hard. If your inventory management is passive, you are losing money to expiry and waste. Re-engineering your inventory. Kill the bulk buying habit. Stop locking up precious cash flow in massive bulk orders of high-cost, short-expiry pharmaceuticals. Adopt just-in-time. Partner with regional distributors who can guarantee 4 to 6 hour delivery cycles for critical, high-value items. Form group purchasing organizations, GPOs. If you run a standalone hospital or a small tier 2 chain, pool your procurement volume with nearby non-competing facilities. This gives you bulk bargaining power with major pharma manufacturers. Controlling facility overhead costs. Smart HVAC integration, air conditioning and ventilation consume up to 40% of a hospital's energy bill. Switch to automated zoning to scale down HVAC power in empty OPD wings at night. Solar power transition. Shift your baseline day loads to rooftop solar installations. With current commercial tariffs in India, the capital expenditure pays for itself in less than 3 years. Module 3, Talent Retention and Nurse Burnout. Every hospital director I speak with echoes the same pain point, the critical shortage of nursing and allied health talent. Attrition eats into your training budget and directly damages your patient care quality. Stopping the staffing leak. Rethink your incentives. flat salaries don't work anymore. Implement tiered monthly incentive programs. Tie bonuses directly to department-specific KPIs, like reduced medication errors or high patient satisfaction scores. Automate administrative drudgery. Nurses spend up to 30% of their shifts filling out physical paperwork. By digitizing your nursing charts into tablet-based EMR systems, you give them back time to focus on actual patient care. This simple fix drastically reduces burnout. Continuous upskilling pathways. Create structured, in-house training modules for niche specialties like ICU care or advanced cath lab operations. When staff see a clear path for career growth within your hospital, they are far less likely to jump ship to a competitor. Module 4. Patient Experience and NAB Compliance. Checklist for the frictionless discharge. Let's talk about market reputation. In the digital age, a hospital's brand is highly vulnerable to online public opinion. A single sequence of 1-star reviews on Google Maps can depress your bed occupancy rates for the next quarter. Solving the discharge friction point. Pre-auth approvals. The number one complaint from patients in India is the 4 to 6 hour wait during insurance discharge. Fix this by initiating the pre-discharge summary process 12 hours before actual checkout. Digital billing portals. Shift payment queues away from the billing desk. Send a secure payment link directly to the family's WhatsApp, letting them clear dues directly from the bedside. Transparent pricing displays. Under recent consumer guidelines, hidden costs are a major legal and reputational risk. Display clear, bundled packages for common surgeries right at your counseling desks to build immediate trust. NAB 5th edition alignment. Treat NAB guidelines as a daily operational habit, not just a frantic audit checklist. Regular mock drills for infection control and medication safety protect your accreditation status effortlessly. Conclusion and action plan. Managing a hospital in India today is a balancing act between clinical empathy and sharp business discipline. You cannot fix everything overnight, but you can start micro-optimizations tomorrow morning. Here is your immediate action plan for this week. Schedule a meeting with your IT vendor to review your ABDM readiness. Audit your discharge turnaround time to find the exact bottleneck between pharmacy clearance and billing. If you found these insights valuable, hit the subscribe button and turn on notifications. Leave a comment below sharing the biggest operational bottleneck your hospital is facing right now. Let's discuss it. Thank you for watching and keep building efficient healthcare systems. See you in the next video. Closing 2026 is demanding a reinvention of the hospital leader. Are you building an adaptive system or just managing a building? Thanks for watching. Don't forget to like and subscribe for your daily dose of healthcare strategy. Disclaimer: compiled information. This content is for educational purposes and is not a substitute for professional advice. The audience must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.